Well, doctors are recommending women should not schedule their COVID vaccine and mammogram close together. That's because you could get a false positive result. And joining us now is Dr. Jason McKellop, radiologist and medical director of Breastlink Women's Imaging in Tarzana. Thank you for your time today.
Thanks so much for having me.
So explain to us, how can the vaccine produce this false positive result on a mammogram?
So the purpose of the vaccine is to prepare your body for a foreign entity, which is the COVID virus. And it does exactly that. It presents something that the body would recognize as foreign in the event that it was exposed to the actual virus. And in so doing, your body develops its own self-defense mechanisms against that virus. And it builds up an inflammatory response or an inflammatory cascade against this potential virus. And in so doing, the lymph nodes, which is the body's essential first line of defense against foreign entities, can enlarge or develop something known as lymphadenopathy. And this is something that we could incidentally note on our screening mammograms.
Because you're talking about the lymph nodes that are sort of in the armpit area. So how long is it recommended for women to wait between getting that vaccine and having a mammogram?
So the data is still coming in as we speak. Generally speaking, 4 to 6 weeks is the time period that we recommend that patients come back in order to document resolution of that lymphadenopathy, meaning watching those lymph nodes get smaller so that we can reassure ourselves that there's no disease ongoing in the lymph nodes or something that may have been potentially obscured by the COVID vaccine itself. So generally, 4 to 6 weeks is the time period that we're hoping, or we'd expect conventional lymphadenopathy to resolve and go back to a normal state.
So it's a pretty easy piece of advice to give people. Just wait probably 4 weeks after your vaccination if you're having a mammogram scheduled. Are you finding more people now scheduling these types of appointments? Because I know in the height of the pandemic, a lot of people couldn't make their appointment for mammography.
Well, one thing I should point out is that the COVID vaccination has no association with increased risk of developing breast disease or breast cancer. I've seen a handful of patients in the past couple of months who have come in specifically for breast imaging because they have gotten a COVID vaccine. So I don't want the viewers to misconstrue that the COVID vaccination has an association with breast cancer, because it doesn't. In fact, it's a good sign that one is developing a lymphadenopathy as a consequence of the vaccine. That just means that the vaccine is doing its job and your body is responding vigorously to the vaccine, and in so doing would respond to the virus vigorously and protect the body against infection.
So are you seeing an uptick in people making their appointments? Because as I mentioned, I know some doctors' offices weren't accepting mammography patients during the height of the pandemic.
Certainly. There was a lull at the outset of the pandemic during the lockdown where patients, or humanity in general, was afraid of going out in public. And we've seen an uptick since that initial lull, where we've seen a high volume of patients coming in for screening. And that's a good thing because we don't want to miss diagnosis of disease or miss out on diagnosing disease that we would otherwise experience in such a lull. So we have seen an uptick. There's been a steady increase in screening. Again, I want to reassure viewers that the association of lymphadenopathy with the COVID vaccination is not something of concern. It's more of a reassuring sign, if anything. But we do pay close attention to this entity as radiologists, as in very rare instances, it can be an indicator of breast disease. So it's a reassuring thing for the vast majority of people, but we do keep a close eye on it because in instances outside of a vaccination history, it may reflect disease and thus the false positive reading on screening mammograms.
Yeah, makes sense, and makes sense too for folks to get back on track with all of their health screenings. Dr. Jason McKellop, thanks for your time. We appreciate it.
Thanks so much for having me.